There is some good news to report on the coronavirus. The number of new daily cases fell over the past week in 42 states. It held steady in the remaining 8 states. No states got worse. The number of new hospitalizations and deaths also on the decline. We want to talk about it now with Dr. Dara Kass, Yahoo medical contributor, Columbia University associate professor of emergency medicine. Dr. Kass, always good to see you. When you see these numbers, a decline in overall new cases, hospitalizations, and deaths, do you think this improvement is sustainable?
I think it's an opportunity for us to really get ahead of where this virus is to stop the spread. This is what we expected actually as early as in November, because we know that the cases that were spreading through the holiday season, through people eating indoors with large scale dinners and traveling, this is when we expected those cases to stop expanding and hopefully start to contract. There may be some artificial decrease in the number of cases, especially around testing and positivity because of the snowstorm that hit the Northeast. But we do think this is a trend in a good direction. What we need to do now is take advantage of this, which means to stop the spread in our communities, wear those masks, get tested, stay isolated, and allow the vaccination programs to take hold so we cannot see another surge after this, like unfortunately we've seen each time.
Yeah, right. Staying vigilant. We just cannot let our guard down, even though these numbers are starting to come down. You mentioned the vaccine. More than 27 million Americans have received a first dose. More than 6 million have been fully vaccinated. We have a long way to go, but we're getting there because this week the Biden administration said it's going to begin sending these vaccines directly to retail pharmacies. How much is that going to change the landscape here?
So every step towards community outreach, towards accessibility, towards vaccine access matters. That is a step in the right direction. We need to have as many partners on the ground in communities. We need to get to people where they are, which may mean community pharmacies. It may be mobile vaccination units. It may mean large-scale vaccine centers in cities that can handle the storage capacity of the Pfizer vaccine versus the Moderna versus any others that come through. So we're moving in the right direction, increasing the delivery of vaccine, but we're very, very far from our goal of enough Americans vaccinated to protect everybody else.
What about Johnson & Johnson's vaccine? I know they're seeking emergency authorization. It could come in the matter of days. That also, one dose versus the 2 that are currently on the market, doesn't need to be stored at those super cold temperatures. Is that going to be a game changer for us all getting vaccinated?
So every additional vaccine is a game changer because we're closer to getting enough people vaccinated. The Johnson & Johnson vaccine has specific utility. One dose, its storage capacity is different. It provides amazing protection against getting sick and dying and actually has a great trajectory of protection. They're also testing if maybe a second dose would make it even better. So I think that the idea that each of our vaccines provides really great protection, especially against the sick patients and dying from this virus, is super encouraging. And I'm hopeful that we're going to continue to see more and more candidates be successful going forward.
We're not at the point where we have the luxury yet to decide which of the vaccines we're going to get. But if a person is deciding between more than one, what should some of their considerations be? Or does it not matter?
So it really doesn't matter. And I want to be very clear that every single one of the vaccines that's been approved so far, we only have 2, but we expect to have a third and probably a fourth, provide amazing protection. Each on their own is incredible. Together, they're incredible. It's unbelievable. So there's no reason to choose between vaccines for the protection level. You may choose to say, I can only get one vaccine. I won't be able to come back for that second dose. Or maybe there is another reason from an operations perspective why you would choose one or the other if you have the choice. But I don't see a time anytime soon where people are going to choose to seek out one or another vaccine, because as far as I can tell, people are just lucky enough to get an appointment and get vaccinated at all.
When you say they offer protection, what kind of protection are we talking about? I mean, if I get vaccinated, which I have not yet, but if and when I do, can I still get the virus? Can I still pass the virus on even if I don't have symptoms?
So the way we studied this, and this is really important because of the speed by which they wanted to understand the most important issue, which was, can this vaccine protect people from getting sick and dying? Can we diminish the effects of even getting infected to something like a regular common cold or the flu? And that was the 95% protection we're talking about, which is that if you were vaccinated, even if for some reason the virus broke through, you still had a mild course, you certainly didn't need to get hospitalized or die. Then people started asking us, well, what if you're vaccinated? Can you transmit the infection? And the answer right now is we don't know, not because we think you can, but because we haven't proved you can't. The AstraZeneca studies out of England just showed that there's a decrease in transmissibility for people that are vaccinated, but we haven't proven that yet for the mRNA vaccines we have here. What I would say to people is it is likely that you won't be able to transmit the virus, but we haven't proven it. So stay vigilant and wear a mask, but realize that even if you're vaccinated, you're going to have a milder course, if at all, in that very small fraction. But most importantly, getting vaccinated protects you from transmitting that, from getting sick or dying. And that's the most important reason why people need to get themselves vaccinated as soon as they are given the opportunity.
Now, we know we've got that more contagious variant of the virus out there. It was in other places, including South Africa. It looks to be quickly becoming the dominant strain here in the US. So do we have any proof yet that what's on the market, these vaccines on the market, will help protect against those strains?
So again, these are questions that come up very, very quickly, and it takes time to get the answers. There are multiple strains out there that are not the original novel strain, and every time a virus mutates, every time it replicates, it has a chance to mutate. So we know that there are thousands of irrelevant mutations and then a couple that take hold. They're testing out now each of the vaccines to double check that they are covering these new strains. And even if there's a change in the protection, it won't be like a light switch. It won't be that these vaccines don't work. It's that they may not work as well. And that was the information coming out about the South Africa vaccine, that the vaccine itself, the South Africa variant, that the vaccine was less effective, not effective. So what I would say is still get vaccinated if you have a chance. We need to stop the spread of the virus, which will stop the mutations. And then we need to wait for the information to make sure that all of our vaccines cover all the variants we know are here.
All right. You always do a great job of making us understand, us non-medical folks, understand all this stuff. Dr. Dara Kass, Yahoo medical contributor, thank you.